It's 1:13, so everybody better be back. So I'm just going to start talking now. Lo's real name is Lorene, but we go by Lo, okay? So Lorene Lloyd has 30 years in medicine, 30 years of watching how systems work and how they fail, 30 years of understanding from the inside where bias hides and where harm happens. She's traveled to, I hope I got this right, Lo. She's traveled to Nigeria to live and learn. She's raised a remarkable daughter with special needs on her own with patience, clear boundaries, and deep kindness. She's a woman of faith who leads with humility and cusses a lot. She loves to cook, to nurture, to create spaces where people feel held. She is also, when her clients need it, a fierce advocate who will not back down. Lorene is an aspiring IBCLC and brings perinatal mental health informed support to every family she serves. She is deeply versed in Black history and the ways systemic racism continue to shape maternal and infant outcomes, and she shares that knowledge generously because she understands that this information saves lives. She's going to help us understand today not just what advocacy looks like in a labor room, but what it looks like in the larger systems your clients are navigating every time they walk into a hospital. Welcome, the brilliant, amazing Lorene Lloyd.
You
Love.
make me sound so good.
Not hard.
Hi, guys. How are you? Again, nice to meet all of you. And she is correct. I am a descendant of the Gullah Geechee people who got that free cruise ship from West Africa. So I am going to screen share. Give me a minute because my computer is going to take you guys away from me. So all I'll be able to see is my screen. But I have my mic on, so I'll address questions after I get done. Come on. See what I'm talking about, Lori?
Yeah, I have your PDFs up if you need it.
I got it. I got it. I'm going to get it together. I'm going to get it together. All right, presenter mode is in. Okay, we are going to talk about race and maternal health, the unethical treatment rooted from slavery. I am now, Lori introduced me as Lorene Lloyd. I am Lorene Oyebamiji. I am owner of Doula in the Middle. I have been a professional doula since 2021. I have been a medical professional since 1993, and I am an aspiring IBCLC. I attend courses with Lactation University under the esteemed Christy Jo Hendricks. We are going to talk about the unethical treatment and assumptions, higher rates of severe complications, and system level complications. Unequal treatment and assumptions is one of the topics is implicit bias. That is the catalyst that drives and leads most healthcare professionals to dismiss and undertreat Black women's concerns regarding their bodies. So to explain implicit bias in layman's terms, that's where medical professionals basically are not listening to what we are saying and making assumptions on what we are actually saying. When you are in the room with your clients, and if they say that it hurts when I bend over and I don't feel my baby move, and if the doctor responds does not coincide with what your client is saying, that's where you reiterate what she's saying. She's concerned because when she bends over, it stops moving, and she gets pain. Do not let them dismiss what your client is and to assume she should be saying. Historical bias stereotypes influence clinical decision, causing harm. Excuse me, my nose runs when I am talking. Causing healthcare providers to ignore patients' concerns. The impact of trust and lack thereof leads to pervasive bias. This makes it less likely that the Black patient will trust the medical opinions and recommendations if they will return to continued care. A lot of clients have decided that since Dr. Adams was not listening to me, I'm not going to go back. My mama took care of us in the house. Grandmama had us on the couch. She didn't have health care. I'm going to do the same. And in most cases, that is okay. But in most cases, that is a concern because if health issues arise, how are they to know? So we need to make sure that the healthcare professional is actually listening. You can actually go to treatments and doctor's appointments with your clients if that is their desire. And in some cases, when you are with your clients, they will allow you to go, especially if they're by themselves. Higher rates of severe complications. Black women experience more potentially life-threatening outcomes. They are 3 times more likely to die from pregnancy-related causes than white women. Higher rates of unnecessary invasive procedures like cesarean sections or endocervical cortage, which is a cervical scraping. The weathering effects of this chronic stress and discrimination increases the risk of preterm birth, and that can be verified through the U.S. Department of Labor blog that was produced on February 7th, 2022. A lot of things in the news you have heard about Black women who were turned away while in labor or not given the due process that they should have gotten if they were not Black. A lot of women have died after giving birth. We just heard late last year about a midwife whose whole practice was preventing Black women from not being heard or seen, and her preeclampsia symptoms were ignored and she passed away. You heard about the woman who was in labor and the hospital said that she wasn't progressed long enough that she can go home and come back, and 4 minutes later she had her baby on the side of the road. We also heard about the woman and seeing videos of the woman in triage and the nurse giving her the "I don't really care" look. And this woman, upon entering an actual room, which wasn't a birthing room, was a triage room, 12 minutes later gave birth. A lot of people that are not melanated assume that we can take pain. We are not. We are just as susceptible to pain as a white woman. It hurts us just as it hurts you. So our pain is not high. Our pain is not equal. Our pain is not lower. Our pain needs to be assessed just as it would if we weren't brown skinned. System level complications. Maternal mortality disparities. Black women are far more likely to die from pregnancy-related causes such as preeclampsia, pulmonary embolism, often due to ignored symptoms. So going back to what I just said, they are not being heard. So because they are not being heard, their symptoms get ignored and their symptoms become fatal. Pain management inequity. Healthcare providers are less likely to recognize or treat pain in Black patients compared to white patients, resulting in lower quality of care. A lot of times medical professionals feel as though Black patients are drug seeking. So in cases where a Black patient will show up and in extreme pain, let's say sickle cell or lupus, and they should get Dilaudid or Demerol or IV narcotics, they're given Tramadol or Tylenol. Whereas a white patient can come in with an extremely bad migraine and they're hooked up to an IV to get pain medicines immediately. So this also leads to a lot of distrust in the medical field, and a lot of times Black patients do not come to the hospital until they are in extreme pain so that they can be taken seriously. And silencing and disbelief. Medical professionals may express lower empathy, describe Black patients as uncooperative, and disregard their complaints, leading to misdiagnosis. A lot of times when Black patients speak up about their pain or about their symptoms, a lot of doctors call them uncooperative in their notes. They call them uh, rude, drug seeking. Like I said, they write this in their notes. And once you write it in Epic, it's nationwide. Any hospital that patient goes to in the United States will see that doctor's note. And then they will get treated just as or maybe worse than the last professional, because now they're coming to a different hospital and they feel like they're only coming there because they have been denied treatment at the last hospital, when in fact they just went to another hospital to seek better treatment. System level complications are diagnosis and treatment delays. Implicit bias contributes to longer wait times, lower triage levels, and a 10% lower likelihood of admission for Black patients in the emergency room. Once again, they're not being heard, they're not being believed, they get sent home. They get sent home, sometimes they die. Sometimes they are sent home, they go to another hospital. Well, what that doctor just wrote in a chart will be seen in that other hospital. So now they have the framework to looking like a drug seeker. And according to the CDC data, nearly 1 in 3 Black women report mistreatment during pregnancy. And that can be validated at the 19thnews.org from August 11th, 2024. Now that you know the background to why a lot of Black women do not like to go to the doctors, let's dig a little deeper into the meat of the matter. The reason why a lot of Black women stop breastfeeding is because it's linked to slavery. And this slavery trauma from breastfeeding is because Black enslaved women had to breastfeed their master's babies before or concurrent with their own children. Breastfeeding didn't present positive connotations post-slavery and was replaced with formula feeding, meaning the trauma that Betty saw her mama go through by breastfeeding and being tormented with coercion made her not want to breastfeed her baby, made her discourage her daughter from breastfeeding her baby, and so forth and so on. It wasn't until 4th and 5th generations post-slavery that a lot of Black women are now returning to natural options for feeding, because now they see the benefit economically and nutritionally for their baby. And here's where I was saying with the slavery trauma, the coercion is slave masters used to take their slaves' children to get the slave to comply with their demands. If they wanted that slave to work from sunup to sundown in the fields, they would take their children from them and tell them they would get their children back when the fields are done. Children were sold to other plantations, not seeing their parents and being threatened with death of them or their parents if they didn't work. So this very child that you are threatening is going to grow up and become an adult that has implicit bias, that is not going to trust white people, that is not going to trust that anything that they did is going to garner them any positive results, because they have been shown no one listening to them. And the effects of this is still happening and is present. It's called social services. It's called CPS. In Georgia, it's called DIFAS, Department of Family Services, or whatever it's called in your state. When a white person wants a Black person to do what they want them to do, and the Black person stands up and advocates for themselves, now they're getting the cops called on them. Now they are getting reports to social services and child protective services, and they are getting threatened with getting their children taken away from them because they didn't do what this white person thought that they should have done. And unfortunately, it's just not white people. I'm just using that as a framework. Sometimes other BIPOC individuals weaponize the social services department against fellow BIPOC individuals because they don't like them or they told them off for whatever reason or another. But they weaponize the system to get revenge or retribution for something that's not valid. Hospital staff and community workers calling police on mothers or family members, threatening to take their children from them if they don't comply to their demands, not the well-being of the children. Because none of this has anything to do with the well-being of the children, but the ego of the person who is doing this. One of the things I want non-BIPOC birth workers to understand, please do not go into your spaces with a savior complex or a white knight syndrome. That means you are driven by a need for validation, purpose, or control. You often insert yourself into situations without being asked. Most allies for BIPOC women feel the need to fix the socioeconomic trauma they didn't participate in, yet their counterparts are perpetuating towards them. Other non-melanated individuals show they are unfamiliar or uncomfortable with the environment of being in a Black household through nonverbal actions that is picked up on even if it's not spoken. So if you have a BIPOC, and when I say BIPOC, I mean Black, Indigenous, people of color. So that could be Mexican, Latino, African, anybody of the diaspora. If you've never worked with these type of clients and you come into their home, we sense your tension. We sense your uncomfortability. Just like we have women's intuition, we have what we call, and this may not be politically correct, but I'm just being honest, we call it Uncle Charlie syndrome. You're coming into a Black person's home. It's not going to smell like your house. It's not going to be ran like your house. And there are going to be mannerisms that you may not be comfortable with. But that is not your home. And you have to respect that household. And if we go to the slide, this is where people call social services. Because they feel like the children shouldn't be handled the way that they're being handled. Or they shouldn't be living in the environment that they're living in. A lot of homes that you're going to go into when you're going for your prenatals will not be very well kept, will not be very organized and orderly. But we have to look past the aesthetics and see if they're a loving dyad. Because just because a mother lives amongst filth doesn't mean she doesn't love her children. Just because children don't have decent shoes and clothing don't mean that they are not being fed and educated and cared for in an appropriate way. How you raise your family is how you raise your family. Do not go into these people's homes and telling them how they should be raising their families. It won't turn out very well. Now, how do you show up? Well, like I just said, you listen. Use your motivational interviewing skills to hear what is being said and not what you comprehend. And one of the ways you can do that is repeat what you heard or repeat what you are understanding them to say. So that gives the floor for open-ended questions and statements so that you can get to the root of the matter. Be authentic. If you have never had a BIPOC client before, say that. Say, this is my first time ever working with a person of color. I'm not familiar with your culture. And ask for clarity if something is said you don't understand. Because it could be just that simple. Something that is upsetting you that you saw can be really innocent and unknowingly upsetting you. To them, it's just an everyday occurrence. Don't overcompensate. And with that, I mean, identify your insecurities and ignorance in dealing with a culture you're unfamiliar with. Until I moved to Arizona, there was a lot of things about the indigenous culture I didn't know. There were a lot of things about Mexicans I didn't know. But being here for 7 going on 8 years, I've learned a lot about the culture that I didn't know before. And that is the same thing with you. If you want to get more persons of colors as your clients, you need to be open and receptive. There is a saying here in Arizona through one of the midwives, Research is sexy. I would love for a doula, a midwife, a lactation consultant to come into my atmosphere and have researched my West African roots so that they can understand that Ogusi and Fufu is love language to us, where it's macaroni and cheese to somebody else. Same passion, different avenues. So just research your clients, get to know their culture. Not saying that you shouldn't have BIPOC clients, but if you are going to be open to those clients, be open to their culture and not turn your nose up to them. And just like the past slide said, we pick up when you are not comfortable. We pick up when you don't understand. We don't say anything, but we know it. We locked it in for future reference. And what will probably happen in that event, they're going to make up a reason, some of them, if they're like me, they're just going to tell you straight out that you are not a perfect fit and they want to move on with somebody else, or they will just ghost you, not return your calls, your emails, not answer the door when you show up. Thank you, guys. I am, as I told you in the beginning, I am the owner of Doula in the Middle. I am on IG, I'm on TikTok, I'm on LinkedIn, I'm on Facebook, but Facebook playing with my page right now, so I haven't been able to do a lot of posting. I'm going to revamp my page, steal my content from that page, and create a new page. But y'all just wait. It'll still be Doula in the Middle. My website is www.doulainthemiddle.com. That QR code is because I treat and see pregnant teens for free. No fees of any kind for pregnant teens from 14 to 17. And I take donations. So that QR code is if you would like to support a pregnant teen that comes under my care, your donations will be used for that. And I thank you.